case here, 55 years old female who has come from adjacent area with complaint of a swelling in the lower abdomen. This swelling is there for the last 3 months and it is painless, but it is gradually progressing in size. So there is no previous history of trauma. She is postmenopausal. कितने बच्चे हैं आपके?
3 लगे.
She has 4 children. And she attained menopause about 2 years back. Now this swelling is in the supra-pubic region and this is gradually progressing in size. So whenever you get a patient like this, supra-pubic swelling, a female patient, you have to think of certain things, that is it related to pregnancy or is it related to a pelvic organ or is it related to the urinary bladder. So these are the 3 common things which are present in the pelvic area. So you start from the history, and we know that there is no history of pregnancy, there is no history of burning during maturation, there is no history of any abdominal complaint in the past. So this is just a swelling which is appearing and it's gradually increasing in size. So now come to the examination. Her vitals are normal. We will concentrate on the abdominal examination. So in the examination of the abdomen, you just see that patient has fullness in the lower abdomen. You come closer. Umbilicus is central. It's slightly transversely stretched. There are no visible peristalsis, no visible pulsation, and there is a bulge in the center of the abdomen in the suprapubic region, around 5 centimeters on either side, and it is ending up to the umbilicus. There is no, of course, there is some area of previous pregnancy, stria gravidarum, on both sides. Otherwise, there is no engorged veins and no visible peristalsis or pulsation. So that is on inspection. Now palpation, you always start just opposite to the swelling which is there. So the opposite will be the upper part, and we like to see whether the spleen is palpable or not. The spleen is not palpable. There is no epigastric swelling. In the right side also there is no hepatomegaly. Left side lumbar region there is no swelling, and right side also there is no swelling. Now whatever swelling is there is just below the umbilicus, and it is from the suprapubic area going upwards. Now this is the extreme end of the swelling. My 2 fingers, it should be around 25 centimeters in the transverse extent and up to the pubic bone, and from the umbilicus it should be around 22 centimeters. So this is around 22 centimeters and this is 25 centimeters transversely. Now the skin can be pinched separately, and so this swelling does not appear to be fixed to the skin. Now we will do the head raising test, which will show whether it is an intra-abdominal swelling or extra-abdominal swelling. Sir, upar uthaiye. Now as you can see, that size of the swelling has decreased when she raised the head. Aap niche kar rakhiye sir ko. Sir niche kariye. Now you see the swelling is appearing. So that is very obvious that this is deep to the muscles of the anterior abdominal wall. So this is a swelling which is intra-abdominal, and it is, when I am touching, the local temperature is not raised, it is non-tender, and it is appearing to be cystic in consistency. It is not hard, this is not firm, but it is cystic, and it is almost oval in shape. It's like this, and there are certain fluctuations. When I'm pressing from here, this is the other end is being raised, my fingers, and when I'm pressing from here, this side is also raised, and this is non-tender, and it is cystic, and it is extending slightly to the right lumbar area, also to the left lumbar area, but otherwise it is confined to the suprapubic region, And now auscultation, the normal vowel sounds is heard. It is not pulsatile and it is not having any bruit over the swelling. Now further examination in this case which is required is percussion, that we will try to do. This is all resonant. Now it is dull. So there is dullness over the swelling. Now it is resonant. So it is resonant away from the swelling, but on the swelling it is dull on percussion. So it is fluctuate, dull on percussion, and it is mobile, freely mobile in the abdominal cavity. Freely mobile in the abdominal cavity. So now summarize the findings. Intra-abdominal swelling 25 into 20 centimeters in size, cystic in nature, fluctuation positive, dull on percussion, auscultation, normal vowel sounds. What further examination is required in this case? We have to do a PV examination and also a bimanual rectal examination if that is needed. So without that, we can make differential diagnosis in this case. This appears to be a cystic swelling. The most common cystic swelling in the abdomen, which is intra-abdominal in this age group in a female patient, is an ovarian cyst. So that is one important differential diagnosis. Then it could be a full bladder, but of course there is no history of urinary complaints, and neither the bladder will not be easily moving like this swelling which is moving. It will not move so much. It may move slightly but not so much, because this is freely mobile in the abdominal cavity. You can see the whole mobility. So it's more likely to be an ovarian cyst. Then there can be a dermoid cyst in the abdomen, that is another possibility. Ovarian tumor, one of the possibilities there. Sometimes encysted ascites is in a female patient who has got tuberculosis. But again, encysted ascites would not be so much mobile as this particular swelling is. And mesenteric cyst is another differential diagnosis, but it doesn't appear to be a mesenteric cyst, but can be, because also there is transverse mobility in the direction of the mesentery. So these are the two important differential diagnoses: an ovarian cyst or a mesenteric cyst. And rest of the findings are against any solid viscera, which is disease like uterine tumor, uterine cancer is one of them, bladder cancer is another one, and there are no symptoms related to that. So GI malignancy again is unlikely, because it would be more in the lateral flanks rather than the center. So the three things which are common in this area, as I told you in the beginning, is first is your full bladder, second is ovarian cyst, and third is a uterine pathology. So by process of exclusion, we come to the diagnosis that it is likely to be an ovarian cyst, which will be confirmed on radiological investigation, especially ultrasound or CT scan. Thank you very much.